In this video, Professor Margaret will walk you through fluid volume status. As always, all of our YouTube videos are free to watch. But if you happen to have downloaded our companion guide from our Etsy site, please be sure to follow along on your own device as she completes the concept map for fluid volume status in this video.
This video is going to cover fluid volume status, in particular fluid volume overload, fluid volume deficits or dehydration, third spacing, and IV fluids. At the end of the video, you will have a completed map that looks similar to this. You can find the link to the maps in the comments. So let's start creating with our blank map. We're going to begin down in the left corner. And we're going to start with children and older adults and age-related concerns. These two populations are at increased risk for fluid imbalances for many reasons. In children, we know that the kidneys are less mature. What that means is that they're not able to concentrate fluid as easily, and so that increases their risk for dehydration. Around age 2, we will start to see this change and improve. We also know that young children especially have more fluid in their extracellular compartments. The problem with this is it is less stable, which means that in periods of dehydration, they will dehydrate or lose their fluids much quicker. Children also require more water for metabolic processes because they have an increased metabolic rate. So in these cases, they use more fluid than the average adult. Last, pay special attention to properly reconstituting formula for infants, as that can quickly lead to fluid volume and electrolyte disturbances. It's important to make sure parents properly reconstitute. Not too much water and not too little water. Now, with older adults, we know that the kidneys deteriorate over time, so that's going to be an issue as well. We also know that the older adult has a blunted thirst mechanism. So in this particular case, that's going to make them more susceptible to dehydration. The older adult has less body water as they age, which also increases their fluid volume imbalances. We also know that older adults take more medications. We know some of these are over-the-counter medications and prescription medications, such as diuretics. These can also alter fluid balance. And we also know that because their kidneys are a little bit older and may not metabolize these drugs as well, that can cause some problems. Now let's start with our fluid imbalances. And we're going to start with fluid volume deficit or dehydration. And you can remember that because it ends with a D and dehydration. The frequent causes of fluid volume deficiency or dehydration is anything that causes dehydration. This may include diarrhea, vomiting, maybe GI losses, such as gastric suctioning. And we also know volume losses. We can lose volume with hemorrhage. And we also lose a lot of volume in burns. Fever also increases metabolic rate, and that can burn through more water as well. And so patients, as they have fevers, they will actually use more fluid up. We also know that if there's an increased urine output, that can cause dehydration, and a decrease in intake can cause dehydration. Manifestations include decreased urine output, decreased weight or weight loss, thirst or dry mouth or mucous membranes, tachycardia. We see the heartbeat increase when we have decreased fluid volume. We see an increase in capillary refill time. So we know that tissue perfusion is going to take longer if we have less volume, probably greater than 3 to 4 seconds. And we also know that fluid volume deficiency also affects labs. It can cause an increase in hematocrit levels and an increase in sodium levels due to concentration or hemoconcentration because we have less fluid. So our electrolytes look more concentrated. And that could be true also for potassium. Now let's talk about fluid volume overload. Fluid volume overload or overhydration. Causes of this tend to be things such as heart, liver, and renal failure. All contribute to fluid volume overload or overhydration. We also know that the RAS system, when it starts to kick in, that's going to increase sodium retention, which is increasing our preload and our fluid volume. We know that increases in IV fluids, maybe giving too many IV fluids, or increases in oral intake can also cause fluid volume overload. As is a decrease in urine output can cause fluid volume overload. Increases in sodium content can lead to fluid retention or water retention. And things such as Cushing's and aldosterone, Cushing's syndrome and aldosteronism. Manifestations of fluid volume overload include increased weight, edema, increase in blood pressure, maybe bounding or very strong pulses. We may see JVD or venous distension. We can see lung congestion, crackles, shortness of breath, and even orthopnea from pulmonary edema. We're also going to see some changes in hematocrit and in sodium because of the dilution that occurs. We'll see a decrease in hematocrit and a decrease in sodium, and those are dilutional in nature. Now let's talk about third spacing. Third spacing occurs when there is a fluid shift or fluid leaks from inside the blood vessels into the interstitial space. The fluid is not in a usable area, meaning it is not in the bloodstream. Third spacing is often caused by some type of injury, maybe ischemia or lack of blood flow to an area, maybe from massive inflammation, a trauma, or sometimes it can happen post-op or after surgery. We see third space occur from loss of oncotic pressure because of protein losses. Low albumin levels actually will cause fluid to leave the bloodstream and move into the third space. Albumin and proteins hold fluid in the bloodstream. So when those protein levels fall, fluid's going to leave the bloodstream and move into the third space. We also can see third spacing when there is a loss of hydrostatic pressure from the heart. So we see this frequently in patients with heart failure. Fluid tends to leak into the interstitial spaces and patients become edematous. Manifestations are very similar to fluid volume deficit. Because we have the fluids, but they're not in a usable spaces, patients often have symptoms similar to fluid volume deficit, with the exception of a stable body weight. They will not lose weight because the fluid is still in the body, it's just in an unusable area. And they usually still have edema. It's just the edema has shifted into that third space. Eventually, third spacing resolves as fluid moves back into the circulation. When that fluid moves back into the circulation, you will know that because you will start to see an increase in urine output. So how do IV fluids play into fluid volume issues? IV fluids can be isotonic, meaning their normal tone is the body. They can be hypotonic, which means they are less toned than the body, or they can be hypertonic, which means they have more tone than the body. Depending on the tonicity, fluids and electrolytes can shift in the body and either cause or correct fluid volume issues and electrolyte issues. So it's important for the nurse to understand the IV fluids that they are giving. Hypotonic solutions are great for maintenance and ongoing fluid maintenance. Hypotonic fluids include half normal saline or 0.45% sodium chloride. Isotonic solutions are great for rehydration, maybe fluid resuscitation, and they're good for administering meds and blood. Isotonic solutions include normal saline or 0.9% sodium chloride, lactated ringers, blood, and albumin. Hypertonic solutions are used rarely. And if they're used, they must be used with extreme caution. They may be used for a short time if the patient has cerebral edema. A hypertonic solution might be something like 3% sodium chloride. Now, D5W is a very interesting fluid because in the bag, dextrose makes it hypertonic. However, once it's infused in the body, it becomes hypotonic. And the reason being is because the dextrose, or the sugar, is metabolized off. So you often see D5W combined with sodium chloride, as in a D5 half normal saline or a D5 normal saline. The addition of the dextrose can help with low blood sugars. And that is it. And here's your completed fluid volume map. Make sure you like and subscribe if you found this video helpful. You may also want to review the electrolyte imbalance videos if you're studying fluid volumes because they're very helpful to review together.